What's going on, Macro Perspective peeps? Another episode here. Super excited and looking forward to this conversation today with Taylor Stull, CEO of Flowell. Taylor and I connected. Actually, their team reached out, and I'll let Taylor kind of cover. But we are working together on a project basically, and he's working with so many coaches at this point of being able to allow new and upcoming coaches to basically come into the space of online coaching and be a mentor to them. And I'm excited to have this conversation with him, Marcos and I. So with that being said, Taylor, would you mind just kind of doing a little intro for us of who you are, what you're doing, what you're excited for, and we'll kind of just start off there, my man.
Yeah, absolutely. Thank you guys so much for having me on the show. Really pumped to be here and have the opportunity to share a little bit more about myself and Flowell. So we can start with me. My background professionally has been in preventative health. I've been into health and wellness and sports, exercise, nutrition, outdoors. Really holistic health changed my life, and we can definitely get into that. And that's why I started the company. But that has been the lifestyle that I've led, and it really been intentional about building community and developing skills to allow other folks to be able to reinforce their own passion and find opportunities to be professionals within health and wellness. So that's what Flowell does. But to stick with me, professional background, preventative health product management at Mount Sinai Health System in New York City. Did that for about 5 years. Moved over into value-based care, provider partnerships. For those listeners who don't know what value-based care is, happy to dig into that in this time. It's kind of the future of healthcare. And what we're aiming to do with Flowell, and kind of the reason I started it was because in my career, I saw firsthand how so many people were showing up to different healthcare settings with problems and conditions that largely could have been prevented if they made better lifestyle choices. And so when my business partner, Michael, and I started to say, well, where the heck are all the people in the community that can help lead the way to support individuals in making better decisions? We found out that being a health coach and starting a career in a business in an emerging industry is really freaking hard. And unfortunately, about 80% of coaches end up quitting before they're actually able to get their feet underneath them. And so what we saw that is an enormous opportunity cost of all of these people who are passionate about serving others in ways that can elevate health and well-being to actually meaningfully prevent disease and chronic conditions to move the needle on health in future generations. We're missing the mark when it comes to giving people the tools to be able to actually find success and have that impact that's going to change the trend of declining global health. So that is what Flowell is all about. We provide tools, business systems, coaching, and community to newly certified health and fitness coaches that allow them to get started so that they don't end up in the majority of that I mentioned of coaches who are quitting and abandoning their pursuit of their passion to make a difference in this world for themselves, their family, and their community.
Man, what a background, right, Marcos? What a background.
Wow. I mean, dude, you don't
Damn.
look that old. How old are you, Taylor?
29. I know. I don't look it.
We're the same age, but you're looking like you got the Lazarus Pit going on, or like the Fountain of Youth. He should be the face of anti-aging longevity for Synergenics, Marcos.
For real, dude. Yeah, I'm like, yeah. I mean, I guess we're all in the same age bracket here, which is crazy. I would definitely pegged you as far younger, but then the way you just spoke right there was like, okay, obviously this dude's been in it for a while, 5+ years in that thing. It's like, yeah, that's yeah. I didn't know that statistic either. 80% of coaches giving up after the first year, or right? That's
Yeah. Between a year and 18 months. It's too bad.
That's wild.
I mean, I can actually say that like the first go around of me attempting to do it on my own, I did quit within like 3 months. So
How come?
I'm part of this. I was young, didn't know how to find leads. I don't know, like I didn't know how to market myself. I felt like I didn't know it all. Imposter syndrome. What I mean, you can name it all. It was all me. I also had to step up for what would be my first kid. So I had to like
Yeah.
get a little bit more reliable income, and I couldn't be out here just like trying to potentially make money. I needed actual money. So it was a little bit of a shift, and that then led me into working in healthcare, though. So obviously, it all worked out for the right reason. But you know, I can honestly say that I'm part of that statistic to a degree because I know that I quit as a solopreneur, or yeah, I guess yeah, going in business for myself as a health coach for a little while. Yeah. Seamus.
Yeah. No, what I wanted to ask Taylor, like, so I guess we'll kind of deconstruct it a little bit. So I've been close to healthcare all my life. Taylor, my mom, she's member services at Kaiser. I don't know if you know what Kaiser is, but like with Kaiser and all that, and with healthcare there, it's just I've always been around her dealing with high numbers, right? High number of people always trying to get the cheapest kind of thing, and all that stuff. And you know, I've always been around that world of like in our community or in our society, like we really rely heavily on our healthcare, but there is so much of people not getting the healthcare that they need from reactive care, right? There's a lot about that. What did you see were some of the major red flags with people and what they were getting with healthcare? What are some of the key ones that for you made it frustrating for you to be like, I can't stay in this any longer?
Just to be clear, what can't stay in the traditional like institutional
Yeah,
healthcare setting?
the traditional healthcare setting that you had and your old
Yeah,
position where you were at your work.
yeah. I mean, the big thing that was shocking to me was when I asked social workers who are responsible for connecting people to resources uh, and creating that access to supplementary care outside of a clinical setting. I asked them like, hey, what can we do for this person who is suffering from extreme hypertension and doesn't have a caretaker at home or isn't able to get the medications because they can't actually get to the pharmacy because they don't have a car and they're extremely obese, right? Like those types of questions that these people who are fully responsible for the care of these people should have an answer to, they didn't have an answer. It was like, I don't know.
Mm,
I don't know how that's going to happen for them, but they're going to leave this care setting and it's not going to be my problem anymore. And that type of accountability, the lapse of accountability, just really made my blood boil, to be honest. And it drove my boss insane because I came in as this kid who was like, we're going to change healthcare. And we were part of this initiative called DISRIP, the Delivery System Reform Incentive Payment Program. It's a mouthful,
mm,
but basically it was the $7 billion initiative put forth by New York State to basically transform the way that the Medicaid population, so the most at-risk, chronically ill, like unhealthy of the unhealthy people received care. And so there was enormous funding, right? And what I found was, and I'm not, this is not one person, it's just the nature of the immovable object that is the American healthcare system.
mm,
But there were tons of money, tons of opportunity, and a lack of buy-in from senior executives around change and physicians around change. And so it was like, yes, do we need to implement new systems, adopt new workflows, potentially lean on new types of care providers for like health coaches in the community? The answer is absolutely. The answer is yes. And do we have the funds to be able to implement types of projects like that? The answer is yes. But did we have a ticking timeline because this funding was going to run out in 5 years? We did. And did people drag their feet for the years 1 and 2 and 3.5? Yeah, they did. And all of a sudden it was like, holy shit, the timeline's going to end, the money's going to be done, and we haven't actually done anything. And so that's where I was just like, I need to get the hell out of here, and I need to take what I know to be true of people who are like me that recognize the inefficiencies in the healthcare system and recognize that we got to get ahead of this problem. Reactive care, as you said, is just not the answer, and it's just been this vicious cycle and trend that has happened since the birth of institutional insurance in the 20s, and like it's got to stop. And unfortunately, like fortunately and unfortunately, it's going to take passionate individuals like you guys and me and the community that we're building, and it's going to be a grassroots approach because the trend in the industry is that patient-centric care, human-centric care, the power to the patient. So it's like once patients start to get savvy, I don't even want to use the word patient, like once people start to get savvy around, hey, like if I just take care of myself, then I don't have to do that. Or if I don't take care of myself, then this is what's going to happen to me. Like
mm.
drawing that awareness and ensuring that, this thing called health literacy is ubiquitous and is baked into just like education systems, both like at a collegiate level, but also, we're making sure that parents are literate such that they can inform their children about healthy decisions. It's like that cascade effect is how we actually get ahead of the curve. And I know I'm kind of just diverting from your original question of why the heck I got out of healthcare, but it's to incite a movement of people who recognize that something needs to change and who are willing to take a stand and say, I'm going to be the source of that change.
Man, that's
Yeah,
that's
you're
pretty
referring to
freaking beautiful.
proactivity, man. Yeah, that proactive versus reactive care,
Yeah,
effectively, right?
yeah.
Like, I mean, yeah, it's ah, yeah, literacy. You mentioned that word quite a few times, and it was like
Health
that
literacy, right, Marcos?
health
Dang.
literacy. Yeah, yeah. I mean, that that idea, right? It's like expected of you to pay your premiums for healthcare, but I actually want to do a little social experiment. And anytime I go into an office anymore, I'm just gonna say I have no insurance, I'm not covered. What's the cash price? Because I guarantee I can almost get a better rate, right? Because they don't want to deal with insurance. You're getting paid 90 days later. You already know this, Taylor, I'm sure, right? Like it's at least 90 days before you're actually getting that money into the business.
Yeah.
That business wants that money today. Which client are you going to serve? This is literally, you know what is the funniest thing that I actually realized? And this is the hack for everybody. This is related but unrelated. Why is it that a mobile order will always take precedence over the actual human? Because it's paid in full. So fucking pay in full. Literally, that's the secret to life. Learn to pay in full. You get what you pay for. Literally, I don't have to take my shoes off when I go in the airport anymore. TSA pre, I paid for it, right? They don't even look at my backpack. Literally, they're not even paying attention to it. They're like, whatever. This dude paid money. He obviously knows to get on this list. You got to abide by the rules. Pay in full. So why not offer that same thing to those people? Is that money more valuable to you today, or is it more valuable to you in 120 days? Right,
Yeah.
dude. It's like it. It sucks, and a lot of businesses still have to operate in that space. And I see it even more because my best friend right now is, a physical therapist. So he's talking about this. So I'm learning, like a mentorship almost through him, understanding those principles that I never have to touch. But it's a broken system, no doubt.
Yeah, it definitely is. And, that's in building my company. I've been pretty intentional about running adjacent to healthcare, uh,
Mm-hmm.
because I don't really want to deal with it. It's like it, like truthfully, that's absolutely the case. And, you have to know the regulations so that you don't cross lines unintentionally. But thankfully, you have good advisors and experience in the industry and whatnot, and you're able to do that. But yeah, it's a cool, like, fitness coaching, health coaching, nutrition coaching. There's this opportunity to, get paid in full, right? You don't have to deal with the healthcare system. You help people live healthier, which is excellent. And
Mm-hmm.
there's no doubt, though, to add to your point around it. Like, obviously, you want to get paid in full, but there's healthcare is a $4.3 trillion industry, right? It's like
Yeah.
it's massive, and so that's a lot of money flowing every year. And so for coaches or for personal trainers or for fitness coaches or nutritionists or whomever, like right now, they might be providing services to people that are actually going to save those insurance companies that are paying out that 4.3 trillion every year. They're going to save them money, but they're not seeing any payout from the insurance companies, right? Like how backwards is that? And so that's where this really unique opportunity is starting to bud right now. Like in the last 18 months, the first codes ever have been released by CMS, the Center for Medicaid and Medicare Services, which is basically the biggest insurer. Um, and it is for nutrition coaching and health coaching and preventative services. And so all of a sudden now, coaches just like Seamus, who's doing nutrition coaching and preventative health stuff with the right certifications and the right training, the right stamp of approval, all of a sudden he can tap into that 4.3 trillion that's flowing. And the perspective of the insurance companies, this is like, well, the people who are comorbid, which means they have 2 or more chronic conditions, or who are highly at risk, and in a population of people that is like, let's just say, if they're hyper obese and they're 55 years old, right? Like the way, and I hate to say this, like, and I hope that that person out there that's listening, that person will take the stand to not fit into this demographic, but from the eyes of the insurance company, that person is a lost cause. They're going to pay until a lot of money until that person dies. And so now they're starting to think, okay, how can I not get myself into a situation, my company into a situation where I've got, millions of people just like that I'm going to be on the hook for increasing medical expenditures year over year until that person no longer is on this planet. And so why are they starting to say it's worth it to pay coaches is because that's the only way to get ahead of that trend. And so it is right now that this new industry of the overlap, right, of health and wellness and traditional healthcare is being formed. It is right now, it is today. And it is the whoever recognizes that and says, like, as a coach and as a business owner like myself, and says, like, holy shit, this is the future. Let's position ourselves to be able to take advantage of that, even if it means I have to operate in the revenue cycle of traditional healthcare and get paid 90 days later. Well, if traditional healthcare is sending me dozens of clients every single month, maybe it's worth it to figure out my business model where I can get paid 90 days and make sure that, I served some people 90 days prior to keep things going. Because all the micro economy of coaches fitting into the healthcare ecosystem is happening now. And, at Flowell, what we aim to do is help health coaches and nutrition coaches and fitness coaches understand that transition so that they can benefit financially as the floodgates open and they're able to tap into that 4.3 trillion that's flowing every year.
That brings up a question,
Dang.
though. That brings up a really good question here, though. So, like, what are the credentials that are necessary of said health coach in order to then be able to bill insurance, and also at the same time, what is the potential cap, right? Like, what's the cap of number of people that you can actually like ascertain, right? Like, I know that we can use an app and we can use these, different things, and maybe that's obviously what you're looking to provide. I'm looking at your page simultaneously as you're talking, in Flowell, right? But like, do you actually have like a potential number that you know of that's like a cap for coaches? One, and then two, like, I mean, what are the credentials?
Yeah. So number one, the cap is going to be based on the number of people that you can physically see. So there's a lot of opportunity in coaching, right? To make
Mm-hmm.
to make money. You can be a content creator, you can have an online course, you can be a speaker, you can do one-on-one coaching, group coaching, all those types of things. Well, the insurance companies are really freaking specific around what they pay for. So one-on-one coaching is what they pay for right now. There's actually only 5 codes, but it will be increased right now. There's
Is
something in
it
Congress.
is it in person? Is it in person one on
No,
one, or could it be like
telemedicine,
online?
telemedicine.
Telemedicine.
Tell
Yeah. Okay.
Okay, cool.
Does it have to be well? So for telemedicine, does that literally mean a Zoom call
Yep.
officially? Okay. So you can't be calling on a phone call. It has to be face to face.
Yeah.
Something you could
As
record,
far as I
right?
know. Yeah, it's something that
Okay.
you record and it's auditable.
Okay.
Got it. Okay.
Um, and then to answer your question is like how many calls can you take in a day without burning out and without needing to spend that time on marketing, right? Like if you're an independent practitioner, then you're an independent
Yeah. I
business
mean,
owner. You operate under the same parameters as any other business owner, which is sales, marketing, product, right? Like you have to have those
what's
3 things
what's the
dialed in.
billable amount though? Like, I think it depends on the actual like what are they willing to pay in
Insurer,
terms of
yeah.
yeah.
I
What's
don't
the
know the number off the top of my head.
yeah. I mean that's something to consider because if it is like all right, well, one, if like in the audit, like there's telemedicine, but it's like once a month they have to have a telehealth visit, right, with you as the coach, and the remainder of it could be calls. That obviously works better in terms of scheduling for people. It just seems like there's like maybe a potential lot of gray area currently,
Oh,
as my
definitely.
mind ascertains this as a coach, right?
Yeah.
But realistically, I don't mind that, but like you just said, I think the physical governor for most people is like that Zoom fatigue sets in probably by hour 4,
Totally
guaranteed.
agree.
Yeah,
Yeah.
100%.
Yep.
Yeah.
So that's where, it's to the discretion of the coach, right? Like I can't say how much or how little. I hear the Zoom fatigue. I'm on Zoom calls probably 7 hours a day. Like I've been on Zoom calls for at least 6 hours today, and I'm here talking to you right now. So it's like to each their own. But to answer the second part of your question of what accreditations do you need, so right now you need to be board certified with the National Board of Health and Wellness Coaching. And
Oh
so
my
this is
God.
Good thing. Good
We're both
thing.
about to do that
We're
right
both in
now,
it.
ironically enough.
amazing. Yep. So that it's like people are, I get the question a lot of, why is it needed to be, or why is it necessary to be board certified? Like, what's the difference? What does it get me? And this is the answer. It gives you a gateway into a completely new revenue stream, or revenue source rather.
Yeah.
Um,
Dang. So 12 months from now, Marcos and I are just gonna be tapping into that 4.2 trillion pie, man.
Well, yeah, and Taylor, my current workaround is I tell people because an HSA is kind of like your flex spending, and you can spend it on a nutrition coach that isn't necessarily board certified yet. So I'm not going through the process of channeling the insurance myself. I actually have clients if they have a some sort of HSA or FSA
yeah,
that I can actually like quote use Stripe to actually bill properly. That's my workaround. Like, hey, that's actually a tax write-off for you, and I actually just saved you $800 a year based on my going rate. And they're like, oh, well, damn, why wouldn't everybody do that? It's because most people don't know.
exactly.
Yeah.
Like, yeah.
Yeah.
So,
Yep.
oh shoot.
Well, it's cool though, because like there's a lot of movement, and I love that you are already tapping into the HSA, and like that's like a lot of coaches don't recognize that through their clients and their potential clients' employers, right?
Mm-hmm.
They have money sitting around that it's gonna go to waste and just not be used, or like they can use it for the services that you can offer.
Yeah.
Marcos was
Yeah.
the
Like,
one that had to tell me, like, hey, Seamus, you get like you have the car. Like, I had to go on my HSA thing. He's like, go get the physical card. It's like $100 for groceries. I was like, that's $100 I can save on groceries. He's like, I was like, thank God. Like, I was like,
yeah.
every month. I was like, oh, thanks.
Yeah.
Yeah.
Yeah. It's like understanding. Um, also too, like if people were looking for other things like their nutraceuticals or other avenues that they, again, let's just say most people aren't always entrepreneur or solopreneurs or working for themselves. They're, I don't know what the statistic is. Let's just say 80% of people work for a big company. And it's probably higher than that. I would, let me ask ChatGPT real quick. And but essentially, like, okay, most people have that potential opportunity, and why wouldn't you want to save money and also get what you're actually looking for? Right. And I'm like, hey, like, I know it sounds weird, but you're going to spend this money already. Just have it come out of your check and understand this tax game. Like, I think that's the biggest thing is like, again, the government's recognizing that, like, what's our biggest burden, right? It's the last 2 years of your life, right? Our biggest burden on our system is the last 2 years of anybody's life. When are those last 2 years? Whenever you get critically ill or you have those, again, whatever your statistical probability of the comorbidities are, right? Like, and
Yep.
I mean, that's what actuarials people do all the time is crunch these numbers and give you a statistic. And that's where the life insurance rate comes from. It's
Yep.
where, your potential, benefit rates are when it comes to like anybody in your family. And shoot, man, I mean, like I had to pay $700 a month out of my own like hard-earned money just to have health insurance that still sucks. So, I mean, literally, like an urgent care visit for my daughter was $180, like out of my pocket. I'm like, what the hell? Like,
And you're still paying for
It's
insurance.
wild, man.
and I'm still paying
It's
for it.
wild.
It's like, dude, I
Yeah.
bet you I could have paid that cash right at the thing. So that's why I'm like, literally, it's like when you when you ding, literally, I just dinged somebody's car door. Actually, my son did, and it cost me like $700. And I was like, They're like, yeah, dude, if I had to run through his insurance, it would have been twice as much. Like I would have had a bill for twice as much. And it's like, oh, like it's just this giant game, and everybody knows that you play it, but then it just like I think we're like you'd mentioned, now that everybody has a level playing field of like all the rules because we have the internet now, the old guard, the changing of the old guard. I mean, maybe we'll see something catastrophic in terms of a system failure or collapse or meltdown. I don't know. I feel like that's like my biggest worry, honestly.
I hope not. But
Uh,
there's
that
some
maybe
there,
just be.
there's some cool stuff though that like part of the journey with Flowell, like we've always been dedicated to health coaching and to just like health and fitness professionals since the beginning. But just like any startup, we've had several pivots, and one of the pivots this a little earlier than this time last year, before the market crash of crypto, like
Mm,
we had this idea of, what happens if we could, one, create an incentive system for coaches with a publicly traded cryptocurrency, right? So it's like you get coaching and that client gets rewarded and the coach gets rewarded for delivering outcomes and improvements. Um, and also, like, what happens if we could use blockchain to store patient data or to like store health data, right? So that what you're talking about with the collapse of the system, God
mm,
forbid, it's just like, okay, well, if every single person owns their own data, then and there's that ledger, then perhaps the imminent collapse, whether like AI takes it over and pushes it down or whatever it is, like it's there's this opportunity for people to continue to still, have ownership, have security, and be able to take their data where they need to so they get the care that they need.
Yeah.
yeah, and I think every company's kind of moved to that, like owning your data, understand yourself. I mean, it's really what HIPAA's actually there for, is like your protection. And actually, too, like another fun thing, like if you go do your labs on your own out of pocket, no one else can request that information unless you give them the right to it.
Yeah.
Like,
Yep.
so your insurance company can't ask for that, which is another unique thing that we've learned in privatized healthcare. Of course, most people will then go to their PCP and do some other stuff with it. But when I learned that, I was like, oh, like interesting, you know. But like, what is it? The Cologuard screening, right? Like, you know how you're like, okay, people at 45 should be using this to potentially see if they have colon cancer, and it's like 98% accurate. And then insurance just stopped covering it because they're like, oh, now we know uh, the liability of this person is like significantly increased of like the cancer risk because of the testing. And it was like
Yeah.
this weird period of time. I remember like reading about it and hearing our doctors chatter about it for a second. They're like, why won't they cover it? And then that now they do, but I think what they rectified was, now that they know, they're like, oh, there's another way to make money. Now we can charge them higher on the premiums because they had this thing. And of course, everybody's worried about their health, right? It's just like the inevitable. It's like sometimes ignorance is bliss, but like you want to be an informed person. It's like, I don't know. I get the heebie-jeebies about it all the time. That's why I literally am just like, yeah, I don't
I share that sentiment
know.
big time. Like,
Yeah,
I
ignorance.
just
I
I
tell
think
them all
the
the all the time.
like the biggest thing for me, and like to go back to the question of like why I would never go back to institutional healthcare, is just like
Yeah.
I just feel like this, like I can't do anything. Like I'm helpless. Um,
Mm.
Yeah.
as a you know a member of an insurance plan, or just like a person in America that is like subjected to this system. It's just like, holy crap, there's so many inefficiencies. There's literally nothing I can do. And like
Yeah, no, it sucks.
sucks.
I resonated with that story, a lot of yours, with the whole like just trying to figure out that thing for that patient that you're trying to figure out, right?
Yeah.
Like my girlfriend, she's a registered dietitian and she works for this hospital, and like the coordinator on the team didn't empower herself or anything like that to like help this person get like a van, just like a van. Can this person just get a van here and back to get their appointments twice a week because they needed dialysis, right? And you know, my lady, she's a dietitian. She's on this, 8 hours on the floor doing formulas and figuring out all these, clinical. I'm a health and nutrition coach. I the stuff that she talks about, people are dying in front of her, probably, most likely, and she's talked about that, and but like she went out of her way to like talk to the family member to set up the rides, right? Like that to me, like down to the level that I felt and like my lady felt, and like down to like how I see it. That's such a I think there's something broken in the system when people don't feel empowered to just help others find rides to the place, which is what you were talking about, right? Which is just like, it's infuriating just to see how people don't in the healthcare system don't feel like they have any wherewithal to like get something done.
Well, it's definitely not their fault. I mean, it like you said, your girlfriend spends 8 hours a day intensely like serving people, and she
Yeah.
recognizes that likely if I spend the extra 30 minutes to find the answer to this person's question, then that means that my day just like cascades and I'm late to every single appointment thereafter. And that doesn't serve me, my business, or the patient well. And so it's kind
Yeah.
of like the unfortunate nature of the way that the system operates, but also this massive opportunity, right? And where there's friction, there's room for change and evolution, and that's where I personally see health coaches fitting into the equation. Is
Yeah.
the exact instance that you described. It's like, well, this person has a problem, or even if they have a treatment plan, let's say, and they leave, well, who's keeping them accountable to that? Because treatment adherence is abysmal. And so that's really where, somebody having somebody in the community that is partnered with a PCP or with a clinically integrated network, um, those types of things that where they are baked into the system and there's workflows that incorporate health coaches in the community. Like I
Hmm.
see that as the future of healthcare to solve that problem. And, I hope that there are people out there that see that too. But if not, that's why we started the company. And, that's certainly
Yeah.
what we're working
Well,
towards.
that's what I've been seeing too. I was talking with my mom, and she's still at Kaiser in Woodland Hills here, and at some point she was gonna get like a major director position, but she didn't want to do that, and it was like because she had to travel everywhere. It was like all over California, like Sacramento down to San Diego, and like manage like 5 areas. And I was like, I don't know, but she's starting to say that like the health, a lot of these different positions, like the registered dietitian, the physical therapist, they're taking on the role of the health and wellness coach, which to me is kind of interesting because I don't know if that means I don't know, maybe you know more about this, but like I was like, but doesn't that take away from their primary function, their primary role? Wouldn't it just make sense to plug in, like if like someone like me who is getting a health and wellness position to be there to reinforce that as part of that concierge team or part of that healthcare team, right? Because I was thinking about, I'm like, if we're already, and I mean California in and of itself in terms of its healthcare, like our economy in terms of healthcare is probably hitting that 4.2 trillion pretty hard, right? Um, so my thoughts are like, we must just be super impacted then. We just might, there's just so many people in reactive care that like, there's no way these physicians, these physical therapists, these dietitians, these like, they want to do an extra job. You know what I'm saying? Like, I don't think they want to do another job.
I would agree with you. And not only do they not likely want to do the job, but probably not trained or equipped to do the job with motivational interviewing and, having the basis of behavior change over time and some of the fundamentals of coaching, right? Like they are, very deep in didactic expertise, but not necessarily the like
Oh, hold on. I think we lost you for a second. Sorry. I might have been lagging. Would you mind saying that one more time, Taylor? I apologize. Like last 10 seconds.
I was just saying that there's this massive opportunity for health coaches to step in because these folks are trained really deeply uh, in whatever their area of expertise is, right? And of course to deliver patient care is one thing, but to work with somebody and to recognize, contributors in their lifestyle and in their mindset and in their environmental factors that lead to less than optimal health outcomes, like that's not necessarily what they're trained to do. And so that's
Yeah.
why, there's a gap. And until there is a role like truly designated as, the health and wellness coach, then we're going to continue to see suboptimal outcomes.
Yeah. I 100% agree. I mean, that's why, Marcos, he got awarded a scholarship. He got out of his way. He could tell you the story of that, but he got awarded the scholarship for the PN2 Master Health Coach, and I jumped on with him because I was like, hey, we're gonna go through this struggle together, go through the classes, lectures, and it's a 12-month thing, 6 months to finish the NBHWC approved training. Then it's another 6 months to do the studying for the NBH test itself. So we take that in March next year. So it's like a whole 11 to 12-month thing. And in just the 3 lectures alone, they really do literally say, we're going to get away from that didactic, from that, prescribing you the things, but letting that person draw in a little bit more. Hey, let's ask about the lifestyle. What is it that you're doing? What else is going on? What else? What other factors do you think is helping out going on? And what I love about it is they're helping the person, like we said, owning their data, own their health in their own hands. And that health and wellness coach is asking and coaxing the right questions in place and then delivering options. Not necessarily saying A, B, and C you're going to do, but being able to go, okay, what do you think we can do together?
Yeah, it's it's it is kind of different though, in the sense that like health coaching is not about X's and O's at times. Obviously, the coach understands the X's and O's because you filled out the health questionnaire, and we know the goal is to reduce your A1C and, restore your metabolic health and, all those things that are prudent to optimizing health. But realistically, what people don't realize they're signing up for is a shoulder to lean on, someone to cry to, someone to just, be the punching bag at times. And that transition mentally since 2020 to now has been like, I mean, I wear probably all my clients on my sleeve. Like, you know what I mean? When they come to me with bad news, I feel bad for them. It's a very different empathetic feel. And so while of course we're wanting to build up the population and army of people that can make a great living, also identify whether or not you are an empath before even considering this as a potential career option,
Yeah.
because it is mentally demanding at a whole nother level. These Zoom calls, okay, like 8 hours a day, I can work from home, fucking great. You know what I mean? It's like, no, it's
Try
not that
it.
kind of,
Try it
it's
out.
not an 8 hours of you like just cracking the whip and telling people, hey, by the way, you're going to get this thing done. Here's the timeline. Here's the deadline. Completely different understanding. And a lot of people were like, I thought it would be faster. I was like, faster? It's like you're down over 30 pounds in under a year, and you've kept it
Yeah.
off, and you've had
Hmm.
vacation. You know what I mean? And you've had like, so like, if you are a type of person that is genuinely interested in understanding to find the wins for people in their journey and keep them on the journey as long as possible, then your job is great. And the other thing too is though, once you build that rapport and that connection, because realistically, this health coaching model is connection based, and those people can get to their goal and then sustain it, you may not never be taking on new clients, which kind of sucks at a time because you can't help more people. But at the same time, maybe your network is 80 to 100 people deep, or maybe it is 200 because the other people are so good they've evolved to less communication with you. But it is like I said, like when I leave certain calls at the end of certain days, I'm zapped. My wife's like, "You're useless after 7 p.m." It's like, yeah, you're taking someone who's a very logical person and putting him into a room with people that are not dealing things logically. They're doing it emotionally. And I've even succumbed to emotional pressures. I was telling Jameis as before you hopped on here, Taylor, that yeah, he's like, you're gonna get shredded by your birthday. I was like, nah, I'm still dieting. I'm not gonna be shredded. Like, I'm like, I'm failing because every night I just deal with this damn emotional struggle, and I just can't overcome it. But I've also come to terms with like, I picked it out. I know what's going on,
Yeah.
and and that's the thing is like, maybe if I did have a coach and someone's like, you could just do this instead. It's like, oh shit, yeah, probably, but
Coaches
um,
need coaches too, Marcos. Coaches need coaches too.
I know, but I gotta feed a family, and extra expenses for myself is something a dad doesn't do, right?
Yeah.
But yeah, like the self care. I think my only worry is like, so obviously like getting into this modality, right, and having like the physician network in addition to the coaches and all working, cohesively. I mean, and Seamus and I run into this all the time. Whatever the doctor says sometimes takes, like, it's up here and then we're down here. Like
It's because we
like
don't even have the letters behind our name that like so many people I feel just like even my doc goes, anything I'm gonna tell you, Seamus is way better at. And they just don't even care still, you know? And I'm like, it's okay. That's all right.
yeah. But maybe it is with that certification, that relevance and understanding for people that like makes this product so great for you guys. It's just that like you guys are like the internet, right? Or that thing ain't gonna work. Everybody's just gonna call everybody on a cell phone. F that, you know? And then Google happened. And then you can search things up. Then Google Maps happened. You can go where you're at any point in time. And now we have AI, and you literally are like, there's a job for people that can prompt the AI tool the best. You know
Yep.
what I mean? That blew up literally since the beginning of this year. And like, oh, we're all gonna lose our jobs. Like, no, just got to adapt to the times and understand that like the human condition and the human mind is constantly adapting to a bunch of new stimulus at an exponential rate. And I mean, shoot. I mean, there's the online, but better health, right? Better help, right?
BetterHelp. Yeah.
Yeah, better. I mean, online-based telemedicine, telehealth for like psychological things. It's no different than a health coach, realistically. But I'm
Yeah.
assuming those people are just psychologists by you know by trade or by school.
Yeah. 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 And trained to be a therapist. I mean, that's like just like you get a health coach certification, like you could get an exercise science degree, a nutrition degree, but like, are you ready to be a coach? Do you know how to
Yeah.
listen deeply and be able to feed it back to somebody in a way that's going to unlock insight for themselves? I don't know. You might get it with practice, but it's helpful to have some level of education. It's the same with therapy. And it's a really great example, honestly. The therapists, like therapy wasn't really commonly looked at as something that is accessible and should be explored by every person until just a handful of years ago, right? Like I think the first time that I heard about therapy and even considered it was when I saw Michael Phelps on an ad for that. It's not BetterHelp, it's the other one, Talkspace, I think. Um, but
Mm.
Michael Phelps was like this, he was a spokesperson for talk therapy, telemedicine, teletherapy, and it's just like now all of a sudden, not necessarily most people, but a lot of people that are in your circles have a therapist, and it's so great, and it's like it's freeing, right? And so I certainly see that same trend of like kind of ubiquitous acceptance of, wow, this type of professional is really good for me and is really good for the people who have access to it and who are leveraged to them. It's the same thing that's coming, but within health coaching.
So true. I
Yeah.
mean, shoot, some like literally last night on the NBA game, I think it was like two or three people. They're like, "Oh yeah, this person has come out of like dealing with like mental health issues and mental health issues and mental health issues," and it's like, I mean, maybe it's because they're under a tremendous amount of stress as a high level athlete and they're in the middle of like the playoffs or like their livelihood literally depends on them being a performer. Like it's freaking stressful, and
Yeah.
having an outlet to like talk about that with, it's not a sign of weakness. Rather, it's a sign that like, hey, everybody should help one another, and whether it is in a community setting or whether it is on a one-to-one basis, or maybe it is the group coaching or whatever that is, like small, like everything is. I mean, it's like reconditioning the mind to understand that it's like the only time you show weakness is when you're not willing to actually ask for help, right? In my eyes,
Facts.
that's literally how I have interpreted it. Actually, I can go back to my college days. Damn, it's like 10 years ago already. The time I accelerated my growth in my degree, right, was when I literally went into the tutoring center. I literally just sat there. I was like, I don't get it. And I was like, all right, cool. And I just literally sat there for the remainder of the semester. And because I was constantly hearing people talking about math, I got better like almost through osmosis,
Hmm.
right? And that's to me what everybody can do when you then seek out a community of people seeking a common goal, right? Because someone is probably going to have some anecdotal experience. Maybe they took the same class as you. That was the thing. Like, here's the cheat code to this person's class. Here's the cheat code to life, or here's the cheat code to me. And it may not, I mean, maybe 1 out of 100 people that say it that exact way where it then clicks. And I mean, we've had plenty of people on this show at this point in time. It's like every time it's like, damn, I needed to hear this today. Damn, I needed to hear this today. It's Friday. Damn, I needed to hear this
I
today.
needed to hear
And
this today actually, just because
yeah, like you've like
uh
I'm in a pivotal spot in my life as well, as are you, as is Seamus, and it's like, man, the world is about to really change. And like your product offering and what you're trying to bring to the table for, whether it's the coach being like, again, maybe like me, where I felt like a failure. I'm not good enough. I don't know it. I'm not like seasoned enough. All right, cool. Well, we can help you with that. And maybe you start with 5 to 10, but you need those case studies. You need those reps under your belt. You might have some people that those first 5 to 10 people might be with you 10 years from now, right? And or maybe they outgrow you and maybe they just need someone else to give them a new picture. There's so much to it, but evolving is never bad, right? And again, don't think that because somebody leaves you, it was a personal stab against you or what you had to offer. I think that's the other thing about that 80%, right? They're like, man, the person left and like they went to the person that undercut me and like isn't paying as much. Like, F that person. It's like, just know your worth, know your value. You'll get back on your toe feet. Just continue to serve people. Really, money is just an energy exchange.
Yeah.
Totally agree. Yeah. At
I
the end
wanted
of the
to
day, it's
ask.
just like, oh yeah, go ahead. Go ahead.
No, no, go ahead, finish that, and I'll ask after this.
I was just gonna say like the way to get through it, like you said, money's just an energy exchange, and it's about understanding why you're doing this in the first place, right? Like every person has their thing that got them into this. Like they wanted to look good, they got really into fitness, and that led to it. Or like for me, I had really crippling anxiety, and I found holistic health, and that opened up a whole new world, right? And we talked to literally hundreds of coaches every week. And every single person we ask, why did they do this? Because what is going to get you through those hard times? And like I've certainly found this in my own entrepreneurial journey. It's like when somebody gut punches you, or when something happens that you is not expected or doesn't happen that you did expect, like leaning into that thing that when you wake up, you're like, all right, I'm proud of like the reason why I'm doing this. And I'm like, it's totally worth it. It is because if I see this thing through, then like I'm gonna feel like I had purpose in my life, right? And a lot of people with coaching and helping other people and making a difference in their lives, like it's literally who they are. Like they can't imagine being anybody else. And
Mm-hmm.
that's what we definitely encourage folks to lean into and remind themselves of consistently, because the journey's hard. It's ambiguous, and especially given the reality that this industry is literally being created right now. Like, it's not a ton of people that you can point to that say, yeah, just do it like them because they've done it so perfectly, and it's just like this tried and true way. And you know, or it's like it's not like personal training, which we're finding is, where like we have a partnership with ISSA, and so they just launched a health coaching certification, and so we work with coaches who want to start businesses that graduate, and their personal training line is massive. It's been going on for 30 years. They've probably put into the market, hundreds of thousands of coaches. And the beauty of personal training is like, oh, you can have no experience and you can just go get a job at a big box gym. They'll hire you, right? Like there is a first step that is just, it's been ingrained into the industry. It's known. But for health
Mm.
coaches, that doesn't exist. It's like, what the hell do I do first? and
Yeah.
and the answer for a lot of people is, oh, I'm going to go get a job. And unfortunately, there's just not a lot of jobs because it's you work for a healthcare institution, you work for like Noom or like an app like that. And quite frankly, they, well, at least from the coaches that I've heard that work in those types of settings, it's exactly what you described, Marcos, that you don't want to do, which is 8 hours a day, back to back, 30-minute meetings of trying to be an empath, but also recognizing that the clock is ticking and you've got to get to your next appointment. And there's
Mm.
absolutely no time to go to the bathroom or eat lunch, right? Like that sounds not fun.
Your your
Sounds like
your
my
health
day.
your
So
health
yeah.
goes down as you're managing other
Yes.
people's health.
Yeah.
Yeah.
Like, which is awful. And then people burn out and they're like, oh my gosh, is this what I dreamed of? Am I living this? And it's like, no, you're not, but there's another way, but it does take risk, right? And belief in
Yeah.
yourself and overcoming the things that you mentioned of the imposter syndrome and the self-doubt and the people that say no, right? Like I can't tell you how many people said, like, it just, I know that I'm not a coach, but I work with a lot of coaches, and I am starting my company, and it's like the number of people that have said no to me, that like, this is not going to work, you are stupid, you should quit, like hundreds of times, right? And it's just, I lean into, well, the reason I'm here is to help the world live healthier and to empower people who have the same mission as me. So it's worth it to keep going. And I'm sure that
Yeah,
you guys have the same thing in your own missions and in your own work. And
Man, y-
yeah,
you hit the nail on the head, and for me, it's like
100. Yeah,
it's bigger than me. It's to help other people around me to be a part of that and help other people continue to, expand, health span and the health scape. And I what the shittiest thing is one of the things that can help me create this business and do good by others is a little bit of money and funding, and it's impossible to get because I don't make 25 grand a month. You know what I mean? It's like, oh
yeah,
yeah, like you don't have 2 years and you don't have enough recurring revenue. I was like, okay, well, how am I supposed to make a difference in the world if I can't get a little bit of funding? You know? But
yeah,
shoot, maybe the world brought me to you because you have some people that are in that private sector that understand what it is that we're trying to do and are willing to invest something. It's like, dude, I just want like $50,000 to $100,000 to like get these things up and running and you know get the right audience of people with me and or my team or the team I envision. And it's impossible every step of the way. Is it another curtailment of the government that we currently have to deal with? Oh, I was like, the reason why they want that SBA money though is because it's federally backed. They
mhm,
know for sure if they lend that money out and I have to pay it back to them just like a student loan, right?
yeah,
It's required of me. Or I go belly up entirely and they probably take my house because I have to put that as collateral when I get the money in the beginning.
judgment day comes, right?
yep,
Yeah.
yeah. It's
Yeah.
tough. It is hard.
That's what I really appreciate you going so in depth there, Taylor. Kind of like the health and wellness coach in the workforce, and then that transition out. I wanted to ask you a little bit more, like, so talk about Flowell a little bit. Like you said, you talk to hundreds of coaches each week, and obviously, like, I'm going to be jumping on here to kind of like mentor, kind of talk about certain things. But are you guys taking them through like the step by step? Like, hey, this is how you set up an LLC. This is how you set up your bank account. Like, yeah, just give me a play by play, maybe of like the phase 1, 2, and 3 of how it goes, and then like obviously there's probably continued education of like being in your ecosystem, I guess.
Yeah, yeah, exactly. So, uh, I mean, phase one, two, and three, start, grow, and scale. That's how we put it. The start phase is really about debunking a lot of the feelings of self-doubt, the imposter syndrome. It's a lot about mindset and defining who you are and the value that you have and bring as a coach. Specifically within health coaching, what we've learned, and I'm sure this is the same in a lot of different areas, whether it be any type of coaching, you just need to have a niche and a target audience, which obviously you guys know, and um, a lot of
I
coaches
still haven't
don't.
figured that out.
Yeah, yeah. So we just we help coaches understand, how to leverage their experience, their authentic story, where they want to go and what they have access to define that niche that's right for them. And then we give them tools to be able to build a compelling offer. But then Flowell does all of like the system building for them. So we build websites and the email automations and handle payment and scheduling and all of that, so that they don't have to worry about the technical stuff. And then we offer opportunities to acquire clients, right? And like you said, Marcos, it's super important to get those reps and get the testimonials and just have the things to lean on to demonstrate that you actually have the ability to do this and can can get the feel for it. So we help coaches understand how to do that with as little friction as possible.
Mm.
And then once that happens, they kind of enter into the grow phase. So they've got a few testimonials. They're starting to make some money, and that really entails for us, given our mission of kind of being that bridge between traditional health and wellness and the healthcare system. It's about forming partnerships and leveraging their expertise and demonstrated success with clients to speak to referral partners, whether that be PCPs and different types of physicians, or it be more on like the functional medicine, allied health professional side of chiropractic, physical therapy, integrated nutritionists, those types of folks. And we give them everything that they need because our team has actually built these types of referral networks for themselves. And so we have all the materials, all the, what to say and how to build relationships with these different types of folks so that you can actually find success in building those relationships that are going to provide you clients passively month over month, so long as you continue to deliver value and maintain good rapport with that referral partner. And so that's how we kind of grow their revenue. And that's the first 6 months. And then beyond that, it's about scale. And what we found is that a lot of coaches who are coming to us are um, kind of in the same boat you were saying, Marcus, of, they have family and, kind of, they can't dedicate their full time into the coaching realm. And so, based on the time that they have, we help them understand, well, how can you get to the next level of financial success, whether that be through paid advertising or starting a podcast like this, or, building an online course. Like there's lots and lots and lots of revenue streams. And so we've got people, and that's sort of the reason for the mentorship network that Seamus, you're now part of, is to give access to coaches to people who have found success in various avenues of revenue generation in the industry, and allow that type of coaching, mentorship, guidance, so that they can avoid the mistakes and find success in a more rapid fashion that's just lower risk, all in.
Dang, that's
That's
it's freaking epic.
but
Just
you,
because, like, yeah,
yeah, but the way you mentioned that though, like I don't know, was it DP that said that? Like your net worth is your network, or whoever said that. I don't know if it was on
yeah,
the podcast or if I just heard it or something we talked about, Seamus. Like legitimately, you guys are just being like that network piece to help people figure out how to build their net worth and their specific target audience. And
Yeah.
it does take a good deal of sitting down in deep thought and having deeper conversations with, maybe 3, 4, 5, 10 people. I don't know. I mean, I heard it from 5, 6, 7, 8 people before it really like sunk in, and then it went through 2 or 3 revisions, and now I think I finally have something quote marketable, right? Like, or that I want to put my own things like align with it, And it's cool that you guys have that, and again, like streamlining that process for people. I don't think they really truly understand the value, because it's truly taken me, 8, 9 years now in this industry to understand that. And I'm like, damn, like, and granted, I worked for one of the guys who, right, coaches on being coaches, at this point. And
Yeah.
he literally he's like, I'm going to create that identity. I'm going to write these things. I'm going to do this stuff. And I was like, damn, he literally just positions himself as the expert. And then here he is, kept figuring it out,
yeah,
kept figuring it out.
yeah.
It's like,
What I like what you said, Taylor, though, is like what stood out to me with that whole thing was, for coaches, you connect their clientele to them like this endless stream, almost, it sounds like, of patients coming in, clients coming in, right? um how does that work per se? Like, is it like in their central area? Like, let's say I'm in Los Angeles, right? Like, it's only people in Los Angeles that you guys are finding and pivoting for. Like, you guys got back end systems to like get people from Los Angeles in front of Seamus, or like, how does that work for the coach?
Yeah. So I just want to be very clear. So we do not build the relationships for the coach. We just provide everything the
Gotcha,
coach needs to build the
mm,
relationship for themselves.
gotcha, I understand.
Yeah.
Okay.
So just in the future,
clarity.
absolutely will be the case. Like our goal is to build the referral network, but not
Yeah.
as it stands today. So, but yeah, to answer your question, it's a matter of where the coach is and what their goals are, right? If they want to work from wherever and local community is not important to them, then we're going to support them in understanding, well, given your offer, what type of partner is going to be the most aligned to working with your target client. And then we support them in building out lead lists. So we have teams that will build a list of referral partners that coach can then go engage, right? And then we provide all the
Mm,
materials and whatnot that they can share with that person. And then the opposite is true with folks who are like, nope, I live in LA and I only want to have referral partners that are in LA so that I can like go and stop by their office and keep that relationship going. And so then in that case, then we support them in developing a list of individuals that can align to their client and reside in their local area, right?
Wow, that's freaking powerful. That's freaking. I like that. And then obviously now you're creating this whole referral network, and now you have this whole mentoring network. That to me right there, the mentoring network. I mean, I know when I did the podcast with you like a month ago, um, some people don't. Mentors now are like more, like more so like emphasized and stuff like that. But I know that if I didn't have mentors, if I didn't have people to speak with, like, gosh, man, I feel like my personal training, for example, like being a personal training, strength and conditioning coach, if I wasn't pointed into the right direction, I feel like I would have just been like banging my head against the wall. I had cheat codes on cheat codes. Like people were like, yeah, get to this cert, talk to this person, and then this is how you train, right? And it was, I wouldn't have known that. You can't Google that. You really like, I mean, maybe now a little bit, but like you really couldn't Google that like 10 years ago. And I think that's the same place where like health coaches are now. So I'm glad that Flowell has that, like, hey, this is how you deal with this type of patient. This is how you deal with this client, this situation, and these things. And you can just tap into that reservoir of anecdotal, anecdotal experience. And that, I think that right there is kind of priceless. It's kind of priceless. You could take a coach and have him learn from so many mistakes of others.
Exactly. Yeah.
Mm, man, oh man, this is oh man, how's it that everything is just such a like moment of clarity on our podcast here recently, Seamus? It's
I don't know.
like,
I think it's the guests. The guests are just amazing lately.
uh, dude, I mean, yeah, like that. That's really it. I think that we're. I've never been so happy to have done this project as it is. Like after this week, and having Taylor here today, because there are a ton of people brilliant. I mean, dude, like just the way you like hold yourself, confidence. I have no doubt that you're going to continue to do like dope things with exactly what you set out to do, because it seems like you're, make me want to less work for you, even though I don't, I don't, like that's a really cool character trait for people to see. And obviously you're well experienced, and it really shows. So I really thank you for being here today. I don't really know if I have like, I mean, more, I have like additional probably like personal questions, so we can do that afterwards. But Seamus, do you have like anything else that you feel like is worthwhile?
Honestly, my probably just like a follow up is like you're saying, right now, Taylor, is the time, right, to be in this kind of field, kind of like it's this kind of changing of the old guard, as Marcos would say. But what are some of your expectations or appreciations that you're seeing in this field now? What are you seeing across that, like, that curve that's coming at us? What are some of your thoughts with the field and what's happening? And what are you excited for that Flowell is in that? Like they're at, like, it sounds like they're at the helm of this curve. What are you excited for?
Um, it's a hard thing to just say what, like a couple sentences. I am most excited by the increasing number of individuals who are choosing to serve others in this way, that are recognizing that people need a holistic approach to well-being and lifestyle management that's going to prevent disease and keep people healthy for the long term. And whether that's through personal experience or community experience, it is abundantly clear that this industry is growing very rapidly, and it's fueled by passionate individuals like myself and like you guys. And that to me makes me most excited because, like, I forget who said it, but never doubt a small group of committed, passionate people to change the world, because in fact it's the only thing that ever has. And that is what I believe is happening right now. And it just fires me up to be a player and a uniter, right? Not just me, but my team and and the community that we're building is, positioned to play a significant role because we represent the values that are the same and are unifying amongst all the people that I just described. And so that, to me, when we have the right mission in mind and people can understand it, like there's no way that once this ball gets rolling that it's going to stop. And so that's a pretty exciting thing to look forward to.
100%, man. 100%.
Awesome. And Taylor, I mean, last one. I do have one now that Seamus brought that up. How many people have you guys helped at this point with Flowell? Like, how many coaches have you brought in and like successfully completed your framework at this point?
Yeah,
I know it's still relatively new.
it is. Yeah. So like I said, we pivoted. And so we just launched this program back in November was when we first started onboarding coaches. And at this point, a couple hundred. And
That's
with with the partnership with ISSA just getting ramped up, then the goal is to certainly cross 1,000 coaches by the end of the year, and you know go up from there.
and I and
No
I
doubt.
think I think that's amazing. Like, a couple hundred, like, for a lot of people, it doesn't seem like a lot, but I've mentioned this before. 333 people paying $300 a month makes you $1 million. So, like, it could be very, like, the number of reach or people doesn't have to be in the thousands ever to have anything be like uber successful, at least in like most people's like general like vision and eyes. So, I mean, a couple hundred now, and then that partnership. Next thing you know, it's one, then it's 10. It's going to exponentially grow. That's kind of what we're even seeing here in the cast is like, we started with like 7, 8, 10 views. And then now it's like, oh, wow, this one's at 40, 50 at the start, like of the first week. And it's cool to see because it's like, oh, that's fivefold. Okay. Well, if it
It
fivefolds
is.
again, then it's 250 views before we know it.
Yep.
And then people start going back and they find some of those, like, or we were getting our reps in our first episode.
Oh
So
man, I'm gonna be so embarrassed looking at some of those.
Hey
we'll
guys,
have
we're in
better
this.
audio. We'll have
Yeah.
better audio. We'll have better, um, more charisma, better questions, and also, again, that network of people. And you're now a part of that, which I'm deeply like. I'm excited to see where, like, I think that Seamus and I really want this to be like the introduction to the world, and then bring people back. And yeah, this is where we've grown in 6 months, or this is what I'm now doing for when it's like previous clients or people that are like newer coaches in a particular area of health. So, I mean, it's crazy because we blinked and here we are. We're almost in June. Um, and then you're gonna blink again. And you're like, oh yeah, since we've made that pivot, we've helped. When you hit that four digit, we've helped over 1,000 coaches get, through our system. Dude, you're gonna be like, that happens so freaking fast. Like,
Yeah.
a year in business time is like nothing.
Yeah.
Yeah, yeah.
It goes
Awesome.
quick.
Well,
We learn fast, and yep,
obviously,
that's how it goes.
pivoting and having over 100, hundreds of people already help. That's freaking wild. So, um, awesome. Well, everybody, thank you for listening to this awesome episode. We thank Taylor so much for being here. If there's additional questions that you would like to ask Taylor about, you can find him at, and then insert plug here, Taylor.
Yeah. Yeah. You can find me at I am Taylor Stull on Instagram. And then, feel free to reach out if you have any coaching questions specifically with Flowell. The email address is going to be best. It's going to be coach@flowell.co.
Awesome. And we'll have that linked in the show notes as well for people to reach out there if you are interested in pursuing that and getting some additional insight there. And lastly, if you found value here, if you also feel like the health space is really pivoting and changing like we believe it is, give us a like, give us a comment, give us something. We want to continue to increase engagement and grow the show. We do this on our own time for fun and bring in people that are growing and doing great things. And so any little bit of support helps. So thank you guys again. Hope you enjoyed this one, and we will talk with you all very soon.